loves, it's your girl Angelica coming at you live from mi casa. Welcome to my channel. Welcome back. For those of you that are joining, my name is Angelica Christina, and as you can see, I am all bandaged up like a mummy. I just had FFS, which stands for facial feminization surgery. I am an out and proud trans woman of color, Latina, for those that are inquiring, for those that are curious, and I am from New York City, and I just recently, as I said, had FFS with Dr. James Bradley at Lenox Hill, Northwell Health, and this is day 10. I know. You're gagging. You're like, wait, what? She said 10 as in 10? Yes, honey, 10 days. I am only 10 days out of surgery. Looking like this. Gag. It has shocked me. It has honestly shocked me how my body has been healing itself. I have been also taking arnica for bruising. As you can see, very little bruising. I was very much bruised and swollen the first couple of days, so I will link, I will add some pictures so you can see what was going on. Honestly, if I'm being fully transparent, I was not really feeling up to filming. To be honest, I was still feeling very groggy, very sickly. So my first 48 hours after surgery, I was vomiting a lot because of the anesthesia, and also apparently when you are undergoing rhinoplasty, a lot of the blood that is coming out from rhinoplasty, you tend to swallow that. When you are undergoing rhinoplasty, all of the blood that's coming out from your nose tends to go back down your sinuses, so you're technically swallowing a lot of blood during rhinoplasty, and that makes you really nauseous. So for the first 48 hours, honey, they were like, my nurses were like, you know, you gotta get up, you gotta walk around, and I was like, babe, I can barely blink without being nauseous. So that said, the walking thing, we're not doing that. We're just not doing it. It's too much. But after those first 48 hours, because the first 48 hours were brutal, they were, girl. The first 48 hours were so tough, but I guarantee you, after the first 48 hours, that's when it gets a lot better. It gets a little easier, and also you're hopped up on pain meds. So the pain meds helped so much, like I can't even begin to tell you. And I'm happy to say that I'm off of my pain meds now, but those first couple of days, you definitely need them to just like keep the pain at bay, because the pain can be a lot. And just as a reminder, as you can see, I had hairline advancement. So I had my hairline pulled down, and I also had a brow shave and a brow lift. And so you can see this side is a lot better than this side, no shade. And I'll tell you why in a bit. But as you can see, the brow lift on this side is gorgeous. You know, she's nice and arched. She's high. There's like no flapping, no nothing. She's just snatched. She's snatched, bitch. And obviously, as I said, I also had rhinoplasty, which, bitch, Dr. Bradley did that. Dr. Bradley did that. No shade. Like, he snatched my nose. Boots, bitch. Like, I can't wait. I actually have my follow-up appointment with Dr. Bradley and his team tomorrow. And I can't wait to give him his roses, his praises, because he really listened to me when I said, bitch, I want my nose snatched. I want her little. I want her, like, he did that. He truly did that. So yeah, there was that. And also I had lipo under my chin. And so that's also why I'm still wearing this jaw bra. Such a funny name. But it's true. It's a jaw bra. But yes, so the jaw bra is keeping my under my chin and jaw area nice and snatched. Still a bit of bruising. Okay, yes. So I have a bit, I'll show you. I'll get nice and close. Have a scar right here, and then I have some bruising still along my neckline, but honestly this bruising was way worse than, like, it was a lot of bruising the first couple of days. But I'm shocked, like, I'm honestly shocked that the arnica is helping a lot. My body is healing itself, it's doing the things, like, and my hairline, y'all, I can't, although this is bothering me. So, okay. So we're going to get into what I'm a little peeved about / what I'm not fully happy about. And it's not a lot of things. It's really just like a handful of, it's like 2 or 3 things. So this dent, as you can see, I'm going to get really, really close, as you can see right there. I'm hoping that once I get my sutures out, that's gonna go away. I hope. Not really sure why that's there, like, how that even happened, but hopefully that'll heal itself or whatever. So my other thing, my eye, and this is something that I brought up to Dr. Bradley. Like, I was very specific. I was like, listen, my right eye is a bit fattier. I want that kind of like sucked out. I don't want this to, you know, still be like flapping around, which you can see it's still, which, no, low key, this might be bruising still, hopefully, knock on wood. Knock on wood, but I don't know, like, she's not as snatched as she is. So that said, I'm a little and as you can see, like, my eyebrow over here is like up here, and then my eyebrow over here is down here. That I also told Dr. Bradley, I was like, listen, I'm really looking for symmetry with my face. So I want everything to match up. And right now, as it stands, this is, in my mind, to me, this is giving pre-surgery. This is giving untouched. And that's what's kind of like annoying me, is I really wanted this to be up here. And my other pet peeve is that I really wanted my eyes to be more cat-shaped, like, so I wanted them to be kind of like this. I'm not even sure if that makes sense to y'all, but like, I wanted them to be a little bit like slanted like this, more cat-like. I even sent reference photos of women that I wanted to emulate and kind of give my doctor an idea of what I was looking for. And yeah, this is like really bugging me, the fact that like my brow bone right over here on my left side is kind of gorgeous. It's kind of perfect, no shade. But then this side is still down here, like just like, and the y'all, oh, I don't like that. I really wanted that gone. I really wanted both sides to be symmetrical and to look like each other. So there's that. That's what's like really bugging me about my right eye as of right now. And also I requested to have my buccal fat removed so that my face could be really carved out. And I also asked for fat injections in my cheeks. I'm not even really sure if he did do that or not. I'm going to talk to him tomorrow to see what exactly it was that we were able to achieve that in terms of my cheeks and the buccal fat. Like, I'm really curious as to like what happened there, and because I don't think he took it, like I can still feel the buccal fat and I don't have any incisions in my mouth, so I'm just very confused as to what happened there. So I will be sure to ask him questions and figure out why. So overall, the doctor gave me a good 75% of what I wanted, which I'm happy with. Like I'm for the most part, I'm happy with the results so far. Really can't wait to see once all of the swelling goes down. I'm really excited to see what everything looks like once the swelling goes down and all of the bruising is gone. Can't wait to do a beat, honey. Ooh, like I miss putting on makeup. I really do. I miss doing my makeup and feeling fab. Girl, it's been, but again, it's only been 10 days, so also trying to be really patient with myself and with the process, because this surgery takes an extreme amount of patience and time and effort. So I'm, again, just trying to be patient with myself and let my body heal. My body knows what it needs to do, so I'm entrusting in my body. And also, I've been healing so quickly. Like it's surprising how quickly your body heals after this major procedure. And oh, in terms of my breathing, I don't know if you can tell, I'm still a little nasally. My breathing through my nose is getting a lot better. I was struggling a bit to breathe the first, again, 48 hours of surgery because of the breathing tube that I had once I was under, and also my allergies and like not the best circulation in the hospital in terms of air quality. So that said, I was struggling. Your girl was struggling to breathe. And that was making my anxiety kind of, I was getting really anxious. I was just like, I can't breathe. It was such a struggle. And then my nurse was like, do you want a Valium? I was like, absolutely. I will happily take a Valium. Totally. Like, it's a yes every single time. That was my first time actually taking Valium, and I was like, I could get used to this, no shade, but also don't get used to it, because like I see how habit forming it can be. But anyways, I'm gonna get off for now. It was so lovely to finally catch up. It's been several days. I will add my videos and my pictures in and make my YouTube video all pretty and all that, so you can see the process and see all of the photos from the past couple of days to now. All right, my loves, it was so good chatting. Sending you all love. Mwah.
The next day.
Alright, my loves, just about to meet up with Dr. Barkley for my follow-up. Come on back, sure. How's it going?
Good.
Yes, good to see you as well. Oh, lovely. This is my friend Alex.
So tell me about things. How was everything at home?
Oh my god, everything at home's been great. Like, the recovery has been way quicker than...
Sleep?
Yeah, I sleep great.
Oh,
and I'm actually a side sleeper, so it was a bit of a...
to sleep upright?
Yeah, upright, like 2 pillows, you know, just straightforward, so...
You're dealing with the soft diet?
Yeah.
Good.
Soft diet is good.
It's very challenging.
It truly is. It really is, but, you know, I'm chugging along. I'm chugging along.
Good for just having had major procedures.
I know.
She does look really good.
I know. Like, I'm kind of shocked, honestly, based upon, like, how quickly everything's been going down. But,
so you've
I
been
feel
keeping
good.
the jaw bra on. Have you managed to
24/7.
shower or wash or anything, or not?
Yes.
Okay. Oh,
yes. Very gently.
Can you take the jaw bra off? And
Yeah,
take a look
sure.
at things? I have another one for you, so we can.
Oh, awesome.
Entertain things.
Fantastic.
Okay, and Sabrina's on her way. We're just doing
awesome.
another case, so.
Neat.
Oh
yeah, you're like...
Split off today.
Yes.
Oh, nice. Awesome.
I've been
You'll feel
dying.
much more
I've been literally dying to see, like, the final results. The cast is like such a little tease.
We'll get that, clean it up, take some sutures out.
Awesome.
And how's the diet going, the soft diet?
The soft diet's been fine. I've been having lots and lots of mashed potatoes.
Yeah.
I have been doing some pineapple to bring down the swelling. So
Right.
yeah.
Okay.
And I've been taking my arnica every 4 hours
Okay.
for the bruising. So that's probably why there's yeah.
That'll come out in the next few days. Especially
Exactly.
it turns yellow and then goes away.
Yeah, but like
So
I just have like little spots here that
just check
are
everything
about to go
before I
away.
take the splint off and everything. And what are you doing for pain meds and discomfort? And things like
I'm
that?
almost done with my ibuprofen, but otherwise I haven't been in much of any pain. I can't.
Okay.
I literally can't feel anything.
Yeah, it's gonna be.
It's
that'll
kind of
come
funny.
back. That'll be. Sensory nerves take time with the swelling and things like that. So,
I assume
so
as
just be
much.
careful up there. That's why jaw bra, don't put it too tight because you may not be able to feel it. And then
Yeah, no, I don't.
Yeah. So just it's just real loose support to get the swelling under check and things like that.
Cool.
And then you can wash and just careful with the comb.
Yep.
Like blow drying, but you can wash through and when you clean, you're going to clean around the nostrils.
Okay.
Q-tip, little peroxide, and then a little either Aquaphor or Neosporin, and do it around the nostrils, and do it also around here.
Great.
And that helps break up the little scabs. These sutures dissolve, and
Okay.
they'll come out like little strings.
Okay.
I'll take a few out here, and most of these dissolve also inside
Great.
the mouth. Same thing.
I actually don't have any in my, I don't think we didn't do the buccal fat, did we?
No,
I don't think we did.
Let me check everything else.
Yeah, I think you might have done a fat transfer, which I wanted. And I
The other
did
things I mentioned, because we were planning to do it, but we didn't have those. We
The
can always,
lip.
We can always do that without a problem, but they didn't want you to get charged and things like that.
I appreciate
we
you.
Get the nose and everything. So let me get our equipment and we'll get you situated.
Awesome.
What other questions about recovery?
Well, so my right eye, which was always my like problem eye, I'm noticing it's like a little lower than I would have liked it to be. This is gorgeous. This side is gorgeous.
That could
This
still
side,
be
you see what I mean?
swelling
Okay,
above
that's what
there.
I was wondering.
It's hard to tell until it all comes down because it'll flatten out.
Right.
And it could just be more swollen because I can see puffiness more on this eye. So I think that's remains to be seen. I expect it to go up a little bit.
Cool.
Because we did raise those. That's always, we don't want it okay, we can put stuff here, whatever.
Thank you very much.
Put your head back.
Will do.
Relax. Just going to take the tape off and all this color here. Sometimes the nose can be a little small, but you'll be able to see it. I may put some tape back just for like 24 hours.
Sure.
Doesn't swell up.
I've already been doing like side-by-side comparisons with photos, and I'm like, my nose looks so tiny.
You're gonna have to give us a little time to get the final result.
Oh, of course. Yeah, 6 months to a year, right?
How many days has it been?
It's 11. Not that I'm counting.
Looks nice. Definitely still like fits your face.
I'm gonna put some tape just for the swelling.
Cool.
Do you want to look before I take
do. It's so tiny and cute. I love it. I love it so much. It's the nose that I've always wanted, literally. And it changes my face so much. Like, oh my
yeah, there's
God.
definitely still some swelling up here.
Right.
That'll come down and kind of fit to everything else.
Yeah, the nose takes the longest, right?
Yeah, but it'll all contract and you'll see positive changes.
Oh my God.
Definitely in the next couple weeks, and then by 6 weeks.
It hasn't even been 2 weeks yet.
Yeah.
Not even that.
So,
And like already, like it's so beautiful. Dr. Bradley, thank
Sure,
you.
you're welcome.
Oh my God.
Some tape for the swelling, direct tape.
I'm not gonna cry.
You're good. Done it out.
I'm just like, literally, I wanted this for so long.
So with we're talking about the right side, left side eye. So sometimes you can have asymmetries early on with the swelling, but that'll start to, because on the table everything's symmetric, so you'll start to see that once it all goes down. So we just have to be patient with
Sure.
that part.
What are you saying?
You never had anything done to your nose before at all?
No,
This is
never.
your very first time doing it.
Very first time.
Any questions about the cleaning? Oh, the other thing is you can start saline spray
Oh, good.
on your nose.
Okay.
That helps
That's
keep it nice and moist inside for healing.
right.
Do it twice a day, so 2 puffs, morning and nighttime.
Okay, fantastic. And I do have saline spray at home.
Okay. Okay. The rest of it is on. We'll check you.
Cool.
Can you put your new jaw drop on?
Yay for the new jaw bra.
That package over there, the plastic thing? That's it. Thanks. So you can start progressing a little bit. We still want you to sleep a little with your head up.
Okay.
Still want you to kind of take it easy. The bruising, it should come out in the next few days.
Okay.
The tape again, just like Thursday morning, take it off.
Okay.
Saline spray, the cleaning, definitely once a day. If you want to do it twice a day, that's fine.
Cool.
And what else? The diet, you can start advancing. So you can start cutting up food and chewing on the sides. And yeah, so just, you pretty much eat what you want as long as it's like smaller bites.
Awesome. Yeah, and chewing hasn't been much of an issue at all.
Okay, good.
Yeah. Although, again, it's been soft stuff.
Okay, put your finger on your chin there. Can you hold her hair? Yeah, this is Bridget.
It takes a village.
I know. Hey, listen.
Just hold it like that, and I'll put this on here.
I've actually gotten quite accustomed to wearing the jaw bra. It makes me feel nice and snug. Although walking past my doorman, I'm like, don't look at me.
Well, this is the... You've been through the hardest part. Hopefully this will be
Precisely.
a lot easier.
Yeah, it will
Is it okay in your over there? Yeah, so just more healing, letting swelling go down.
Cool.
And then we want to see you. This Friday's too soon, so we'll see you the following Friday.
Okay.
Take a look, and then you know how you can text Sabrina or whatever if you have questions or need us or something.
Awesome.
So I think you're doing great. Whenever we see any complications, usually within the first week, so you're kind of getting out of the woods with any problems,
right.
which is good. Any other questions?
Yeah, you mentioned maintenance for the incisions up here on the forehead. Neosporin.
So Q-tip with peroxide, the
Got
cream
it.
that helps soften up the scabs.
Okay.
And then you can put just a really light coating of Aquaphor or
Okay.
Neosporin just for the next week. After that, you don't need that. And by then, all the little stitches will kind of fall out.
Great.
And then it can heal in after that.
Sounds good.
Fast healing.
That I am. That I am. I'm very happy about it. My body's been like,
very like, okay, let's do this now.
yeah, exactly. My body's very much like my personality, like, wee.
You're more beautiful.
Aw, thank you so much. Truly, like, you did an amazing job, you and your team. So, appreciate it.
Happy to take care of you. Look forward to seeing you on Friday.
Yes.
And yeah, any questions, just let us know.
Awesome.
You're doing great.
I got everyone's emails, so if I have any questions, I'll...
Perfect.
All right. Thank you very much.
All right. You're welcome. Thanks
Pleasure.
for
Thank
helping her out.
you.